In today's day and age, I think Google is an integral part of you, isn't it? A lot of us, I would use it quite a bit. Hello everybody, my name is Dr Krithika Murugan. I'm one of the surgeons based out of HCG Bangalore. Interesting to answer this question. There are some form of cancers which are completely curable, some of the childhood ones, lymphomas, leukemias and all the rest. I think with respect to cancer care, the ideal word or the better word to use would be remission rather than cure. You can have breast cancers which have gone into remission for 10 or 15 years and then they come back. So I think the better word to use would be remission, and the aim of every oncologist probably is to push the disease into remission for as long as the patient lives. There are two different ways of looking at this. One is genetic and one is hereditary. Hereditary is what runs in your family, and genetic is whatever is caused by the change in a genes. We all know now that most of the cancers are caused by a genetic mutation. There's a fine balance where you have a cell being produced that multiplies and that dies. So it's a very, very tightly controlled process. When some of the genes which look after this bit have gone a bit wonky, that's when cancer arises. So most of the cancers have a genetic basis in them, but there is a difference to being genetic and hereditary. Hereditary is what runs in the family. Those are genes where you carry those genes forward into yourself, like the BRCA gene or the P53 gene or any other familial gene. It definitely can after many years of treatment, and I think that is where follow-up is as important as cure. As in any form of cancer, I think we harp a lot on follow-up simply because it can come back at any point in time. The most common symptom that people come to you with is a lump. Okay? Other than a lump, any form of nipple discharge which is not normal for you, other than breastfeeding, if there is a nipple discharge, please seek a specialist advice, especially if you have bloody or greenish discharge, any change in the shape or the form of the breast, any change in the area of the nipple. If you had pert nipples in the past and then they've started to recede back in, please seek a specialist advice. Skin changes along the areola and overall appearance of the breast, any of these, please seek a specialist advice. Any age really. I think cancer doesn't spare any age. The age is no bar at all. But usually after you've developed breast buds, that's when it can appear. So any time after you've had a breast development, you can have breast cancer, and that could be as young as 12, 13, 14, up until whatever age, maybe even well past your 80s. So age is no bar as such. The commonest age group that we see breast cancer in India is usually in the age group of 30 to 40. I think this is just a lead on from the very first thing where they ask me, do I Google things? I do, definitely. But then if I have a problem, I would approach a specialist first to understand what's going on. And there I don't think Google would be my master as such. Google can help you understand the condition, but I think to actually go through treatment, a specialist is what you need. So if in doubt, seek the help of a specialist.